I am frequently asked questions about the kinds of surgery that I do as a podiatrist. I am board certified by the American Board of Podiatric Surgery. I am also a fellow of the American College of Foot and Ankle Surgeons. The most common operations that I do are bunion surgeries, hammer toe surgeries, heel spur surgeries, ankle surgeries for various defects and painful conditions. We always attempt to start with conservative measures to alleviate patients' pain. Most of the patients that we see have already suffered with their painful conditions for a number of years. They have failed a variety of conservative treatments, and they are now faced with the option of having surgery. Surgery for bunions typically involves a fairly small incision on the side of the bunion. The tissue is carefully dissected down to the bone. A bump is removed, and this removal of bump really creates a platform for me to do the next step of the operation, which is to create a V-shaped cut into the head of the first metatarsal. Once I've created this V-shaped cut, I can push the head laterally, and I will then secure it with a screw. That screw, although it may sound very painful, is in fact not painful at all, and it is really one of the key parts of the surgery that allows my patients to walk the same day as surgery. After the correction is completed, the surgical site is flushed copiously with solutions of antibiotic and sterile saline. Everything is sewn back up. The patient returns to the area where they first presented in the hospital and walks out of the hospital that day. Most patients are able to return to work within 3 to 4 days. Another common procedure that I perform is called endoscopic plantar fasciotomy, also referred to as EPF. When a patient has failed conservative treatment for painful heel pain, painful fasciitis, the decision is ultimately made to proceed with a surgical correction. In this particular case, the repair of the plantar fascia is done through a small scope. It is a minimally invasive procedure. A small opening is made on the medial side of the heel. With a scope, we're actually able to visualize the various slips or bands of the plantar fascia. We've predetermined before we even go into surgery which band of the fascia we're going to sever. Once we've identified it with the scope, there is a little blade that fits on top of the scope, and as the scope is passed across the bottom of the heel, you can actually see the blade separating the fibers of the plantar fascia. The procedure takes less than 10 minutes, and patients are able to walk the same day.